anterior or the most rostral section, and this is the most caudal or posterior one. Here you can see the frontal lobes and part of the temporal. In the posterior one, you see the cerebellum. So this is the landmark to know that this is the posterior one. This is the cerebellum. The sections, section number 1, here it is. It shows the rostrum of the corpus callosum. So this is the rostrum of corpus callosum. This is the anterior horn of lateral ventricle, and this is the body of the corpus callosum. This is the head of caudate. Here is the putamen, and in the middle, this is the nucleus accumbens. Nucleus accumbens joins the head of caudate with the putamen. Again, here is the nucleus accumbens. Between the head of caudate and putamen, the black color is the white matter of anterior limb of internal capsule. So this is the anterior limb of the internal capsule. At this level, this is the level of the optic chiasm. So this is the optic chiasm here. And it also shows the anterior commissure. So the anterior commissure is running from side to side. At this level, you don't say that this part is the rostrum. No, this is the column of fornix. Column of fornix, because it's related to the anterior commissure. So this is the column of fornix. This level shows the amygdala. Here it is. This is the amygdala. It's a dark, homogeneous gray zone close to the midline. Okay? And here it is, the amygdala again. The amygdala. In regards to the anterior tubercle of the thalamus, it starts showing here and then there. The anterior tubercle of thalamus, when you see it, you name the internal capsule as the geno of the internal capsule. So this is the geno of the internal capsule. And again, geno of the internal capsule. This is the anterior tubercle of the thalamus. And you see a cavity of the third ventricle. Here it is. That cavity is surrounded by the hypothalamus. Hypothalamus. This is the hypothalamus. This is the level of the mammillary body. The mammillary body is part of the hypothalamus also. And you can see the third ventricle, and the arrow is pointing to the body of fornix. So when you see the mammillary body, you have 4 other bodies. You have the body of corpus callosum, body of caudate, body of lateral ventricle, and body of fornix. Okay. Also at this level, you see part of the amygdala is still there. At this level, you see the cavity of the third ventricle divided into 2 pieces. So third ventricle above and below. Because there is connection here between the 2 thalami. This is a thalamus and another thalamus, and this is interthalamic adhesion, or massa intermedia. When you see the big mass of the thalamus, the white matter that's lateral to it is the posterior limb of the internal capsule. So this is the posterior limb of the internal capsule. And that posterior limb of the internal capsule runs continuous with the crus cerebri. So here is cerebropeduncle and another cerebropeduncle. This is the interpeduncular fossa. Again, it's the interpeduncular fossa. So how many spaces you have here? You have the body of the lateral ventricle, you have the third ventricle, and this is the interpeduncular fossa. Again, body of lateral ventricle, third ventricle, and this is the interpeduncular fossa. At this level you see the dark dots, these are the red nuclei. Towards the posterior part, you see the fornix is split into 2 crura. So this is a crus, and this is another crus of fornix. So here is another crus, 2 crura of fornix, and the thalamus shows a rounded structure called the palpebra. You can see a midline structure. This is the pineal body, and below it you have 4 rounded structures. These are the corpora quadrigemina, the 2 superior and the 2 inferior colliculi. So this cistern is the superior cistern. And the cavity within the cerebellum is the 4th ventricle. This is a trigon of the lateral ventricle. And in the floor of it, you see part of the hippocampus here. This is part of the hippocampus, it's surrounded in the floor. And the hippocampi are connected by hippocampal commissure. And here is the splenium. It continues here is the splenium of the corpus callosum. The splenium of corpus callosum is seen at several sections because it's a big structure. The lower border of the splenium has the hippocampal commissure, connecting one hippocampus to the opposite side. This is the posterior horn of the lateral ventricle. I say it is posterior horn because I don't see the choroid plexus in it. But in the trigon you can see there is something in the space. This is the choroid plexus within the triangle. The posterior horn doesn't have right ribs. This is a series of MRIs, and it shows whitish area in several sections. You see this whitish zone? So this is cerebral hemorrhage. Okay. The difference between hemorrhage and infarction is that since this is T2 weighted MRI, the CSF is white, so anything that has fluid, has water, will be whitish. And blood has water in it, has fluid, so it is whitish. If it is infarction, it will be dark, it will be like the black color of the white matter. Because infarction means death, means fibrosis, so it is going to look whitish when you look by the naked eye, but here in the T2-weighted MRI, it will be blackish. Because the tracks that are white are shown black in this one.
The T1.
Yes. T1 weighted is the opposite. Okay. Now, in this series, you can see the rostrum of the corpus callosum. Here it is. This is the rostrum of corpus callosum. This is the head of caudate, and this is the putamen. And in between, this is the anterior limb of the anterior capsule. And in the junctional zone here at the side, this is the nucleus accumbens. Nucleus accumbens is joining the head of caudate with the putamen. At this level, you can see there is a black structure joining one side to the other. This is the optic chiasm. So that means this is the level of the anterior column shaft also. So the structure that's seen in the cavity of the lateral ventricle, this is the column of Wernicke. It's not the rostrum anymore. It is rostrum when you see it more anteriorly, when you see the nucleus accumbens. But here, when you see the optic chiasm, this is the part that's related to the anterior column shaft, that's at the same level of the optic chiasm. So it is the column of Wernicke with the post-commissural fibers going to the mammillary body. Remember that? Again, here is the optic chiasm. This level shows a bulge in the medial side, just below the head of caudate. This bulge is the anterior tubercle or anterior nucleus of thalamus. So here is the head of caudate, but this black zone is not anterior limb of the anterior capsule. This is the genome of the anterior capsule. Because the genome of the anterior capsule is seen when you see the anterior tubercle of the thalamus. And here the arrow is pointing to the amygdala. Amygdala you see it very well when you don't have the inferior horn of left ventricle. So this is amygdala. It's a dark, homogeneous gray zone. And the arrow here is pointing to the corona radiata. The fibers of the corona radiata will run into the internal capsule. I think that's all here. This level shows the mammillary body, and it has the several bodies, the body of corpus callosum, body of caudate, and body of Wernicke, and body of lateral ventricle. It shows the two rounded mammillary body. Have any question?